68-year-old patient with chronic kidney disease. He's found to have deficiency of antithrombin 3. Antithrombin 3, or antithrombin simply, is a natural substance found in the blood that prevents coagulation. So its deficiency would account for increased liability to thrombosis. After he presented to emergency department with left leg pain and swelling, so I'm thinking of DVT in this case. A Doppler ultrasound scan of the leg confirms deep vein thrombosis. Okay, I was correct. The patient has started on Dabigatran. So the question is, what is the mechanism of action of Dabigatran? Okay, so here it seems that we are dealing with a case of thrombophilia. And in thrombophilia, there is natural liability to form thrombi. Thrombophilia might be familial or hereditary and might be acquired. So for the acquired, these are the most common, of course, and the most common of which is antiphospholipid syndrome, followed by AIDS patients, and then oral contraceptives. So the familial are more common in Asians, include deficiency of antithrombin or antithrombin 3, deficiency of protein S, and deficiency of protein C. Three of them are natural substance or against thrombosis. Dabigatran acts by direct thrombin inhibition. So there is no antithrombin which acts to reduce the thrombin activity. So Dabigatran is replacing the antithrombin or the antithrombin 3. One might ask, why shouldn't I give heparin? I shouldn't give heparin because heparin activates antithrombin 3. So heparin will not work in this scenario. And what about warfarin? Warfarin needs 3 to 4 days until it starts working. So you'll need something to support in the interim, which most likely is heparin. And again, I can't use heparin. So I need a medicine or a drug that acts immediately, which is a Dabigatran. Dabigatran is sold under the name Pradaxa. And it's an oral anticoagulant. It can be used for prophylaxis against stroke, prophylaxis in coronary syndromes, myocardial infarction, unstable angina, non-valvular atrial fibrillation, AF, or very important, hip or knee replacement surgery as a prophylaxis against thrombosis. So we can have several changes to this question. First of all, we can say 68-year-old Asian, because we know that antithrombin or familial thrombophilia is more common in Asians. We can have the patient needs a prophylaxis, so either had DVT previously or had pulmonary embolism, for example, and he's presenting or waiting for expecting knee replacement surgery or hip replacement surgery. So what's the most suitable anticoagulant for him? I want to clarify something. Why did he mention chronic kidney disease here? So if we take this out, the question will still be the same. But this is a scientific fact that you need to be aware of. Deficiency of antithrombin 3 shows higher incidence of chronic kidney disease, especially following acute kidney injury, because deficiency of antithrombin contributes to renal hypoxia. So he might confirm that the patient has long-standing deficiency of antithrombin 3 by saying, for example, the patient had hypertension, uncontrolled hypertension, or whatever. So this is a table of other anticoagulants. As we have mentioned, heparin activates antithrombin 3. The 2B3A inhibitor is an antiplatelet group, and it's used for prophylaxis in unstable angina and pulmonary embolism in DVT. However, the role was overtaken by clopidogrel, which is a P2Y12 inhibitor, and again it's an antiplatelet. Dabigatran is a direct thrombin inhibitor, as we have mentioned, and the direct factor X or factor 10 inhibitor rivaroxaban. As we know, for coagulation to happen, we need one pathway of either the intrinsic or extrinsic pathways, and both of them activates factor 10. Factor 10 to activated factor 10, which in turn leads to synthesis or formation of fibrin and the blood clotting. So if we block factor 10, if we inhibit this activated factor 10, we will prevent coagulation. One thing left to mention is, if the question says that a patient in this scenario is already on dabigatran and is expecting knee or hip replacement surgery, what should we do? As you know, before surgery, we need to stop the anticoagulants. One of the benefits of dabigatran is that it reverses its action in short time. However, if the surgery is really an emergency, so this patient had an accident, for example, we need to give the antidote. We need to give the antidote to dabigatran. The antidote is a human monoclonal antigen Fab fragment. It's called the idarsizumab. And it's getting approval at the moment for this indication.